अस्सलाम वालेकुम। रब्बी शरली सदरी व यस्सिरली अमरी वहलुल उक़दतम मिन लिसानी यफ़क़हू क़ौली। मैं ये चाहता था कि कुछ बेसिक चीज़ें जो है ना वो हमारे रेडियोग्राफर्स को मिलें जो सर्विस कर रहे हैं अपनी पेशेंट्स के साथ, जो हैं वो जो रिलेशंस उनका बनता है वो गुड फेथ के अंदर बनना चाहिए। और जो हमारे आज का जो मेरा टॉपिक है रिस्पॉन्सिबिलिटीज़ ऑफ रेडियोग्राफर्स ड्यूरिंग रेडियोलॉजिकल प्रोसीजर्स, वो भी इसी हवाले से है। जो हमारे नए टेक्नोलॉजिस्ट आ रहे हैं वो किस तरह से परफॉर्म करेंगे हमारी जगह पे, और हम जो परफॉर्म करते आए हैं उसको शेयर करेंगे। तो इंशाल्लाह शुरू करते हैं। रिस्पॉन्सिबिलिटीज़ ऑफ रेडियोग्राफर्स ड्यूरिंग रेडियोलॉजिकल प्रोसीजर्स। ये है आगे। Contents: Introduction, care of radiographic examination room, clinical, ethical, legal responsibilities, patient consent, radiation protection, high-lead medications. Introductions: Radiographer having a range of responsibilities and bound by the existing ethical code. A radiographer must be very careful in their work. It is essential to make sure that the procedure conducted meet the requirement and compile with the current medical standards. In addition, a radiographer must be able to communicate with the patient in order to avoid making harm to the latter. Once a patient and a radiographer understand each other, the amount of mistake and misconception will be reduced to nil. Yes. Clinical responsibility. Follow the international patient safety goals. How many people knows the patient safety goals? 6 patient safety goals. And फॉर क्लिनिकल रिस्पॉन्सिबिलिटी लाजिम है हमें जो है ना ये 6 पेशेंट सेफ्टी गोल्स: पेशेंट आइडेंटिफिकेशन, कम्युनिकेशन, हाई लेड मेडिकेशन, यस सेफ राइट साइड राइट प्रोसीजर, यस हिस्ट्री ऑफ। तो ये जो हमारे गोल्स हैं ये ज़रूरी हैं कि हमें जो है ना इसके बारे में पता होना चाहिए साथ। यूनिफॉर्म हैंडलिंग ऑफ द पेशेंट, फर्स्ट एड प्रोसीजर, अंडरस्टैंडिंग साइकोलॉजिकल स्टेट ऑफ द पेशेंट, असिस्टिंग फिजिशियन ड्यूरिंग रेडियोग्राफिक प्रोसीजर्स, प्रोसेस एंड एवोल्यूशन ऑफ रेडियोग्राफ। यार ये सॉरी मुझे ज़रा इसका
सर ये नेक्स्ट है और ये बैक है। ये नेक्स्ट और ये बैक।
ये नेक्स्ट है, ये बैक है। Care of radiographic examination room, neat and tidy examination room. Equipment must be cleaned every day. Maintaining quality assurance of equipment as well calibrations. Check of radiation protection tools. Check personal protective equipment and emergency drugs. Responsibility of a radiographer. The responsibility which a radiographer carry for a patient may be considered as clinical, ethical legal responsibility. Clinical responsibility, follow the international patient safety goals, uniform handling of the patient, first aid procedure, understanding psychological state of the patient, assisting physician and radiographic procedure, process and evaluation of radiographs. Professional etiquette, while not always directly related to the ethics, healthcare workers' professionals' etiquette can directly affect patient care and change patient outcomes. Use eye care as a reminder of the principles professional etiquette. Introduce yourself to your patient. C. Communicate effectively and frequently so your patient knows you are. A. Address need of the patient in a prompt and caring manners. Respect, show dignity and passion to your patient. Explain your role on the team. Ethical responsibility, appropriate care of patients, informed consent, personal prejudice must not affect the professional relationship, justification, optimization and LRA, respect and maintain patient privacy and confidently at all time, facilitate and support caregivers. Patient assessment, evaluate patient medical history and conditions, assess patient ability to undergo your radiological procedure, identify potential risks or communication and contraindications. Patient preparation, explain procedure and instruction to patients, ensure patient understanding and consent, prepare patient for procedure, for example, positioning and immobilization. Patient care, provide compassionate care and support, monitor patient physical and emotional well-being, address patient concern and questions. Radiation safety, follow the radiation safety protocols and guidelines, minimize radiation exposure to patient and staff, monitor radiation doses and levels. Image acquisition, operate radiological equipment safely and effectively, optimize image quality and technique, minimize radiation exposure. Image evaluation, review images for quality and diagnostic acceptability, identify potential error or artifact, repeat images if necessary. Quality control, participate in quality control and assurance activities, identify area for improvement, implements changes to optimize image, quality and patient care. Communication, communicate effectively with patient, staff and radiologists, provide accurate and timely reports, collaborate with multidisciplinary team. Duties to health professionals, respect other health professionals, refrain from making unsubstantiated comments about colleagues and the institution to patient or other persons. Duties to society, respect all human rights, deal responsibly with radiation, be guided by the LRA principles, treat all individuals with respect, dignity and without discrimination, providing care regardless of race, culture, national, social or ethnic origin, color, gender and family status, religious or political affiliation, language, age, type of illness, mental or physical ability. Duties to the environment. These may be considered simply limit unnecessary radiation exposure, protect environment by assuring the correct disposal of medical waste, ensure safe environment and take steps to minimize the exposure to potential risk. For example, radiation exposure, a strong magnetic field and risk of infection. Legal responsibility, break of professional confidential, negligence, the process in the event of accident. Consent of the patient. Consent must be taken before the procedure. Many procedures performed in diagnostic imaging department require a special consent form to signed by the patient or their relative or legal representative. The radiographer must be familiar with the procedure that require a special verbal or written consent. It is his duty to check the patient chart to be certain that his has been accomplished. Informed consent, इसमें नेचर ऑफ ट्रीटमेंट के बारे में हम बताएंगे, उसको रिस्क के बारे में बताएंगे, उसको अपॉर्चुनिटी देंगे सवाल करने के लिए, बेनिफिट्स बताएंगे और उसको अल्टरनेटिव बताएंगे. तो उस पर साइन. रेडिएशन प्रोटेक्शन के हवाले से फॉलो दी 3 कार्डिनल रूल्स ऑफ रेडिएशन प्रोटेक्शन: टाइम, डिस्टेंस एंड शील्डिंग. मैंने टाइम कम से कम रखेंगे, फासला रखेंगे और शील्डिंग को यूज़ करेंगे या शील्डिंग के पीछे चले जाएंगे. थैंक यू.